Thank you for taking this opportunity to learn about the West African Ebola outbreak. I hope this presentation will answer any questions you may have regarding Ebola. The 2014 Ebola outbreak is the largest Ebola outbreak in history and the first to occur in West Africa. The first Ebola virus species was discovered in 1976 in what is now the Democratic Republic of the Congo near the Ebola River. Since then, outbreaks have appeared sporadically in Central Africa. Most of those outbreaks have been small and have occurred in predominantly rural areas. The last documented Ebola outbreak in 2012 had a total of 7 known cases. Currently, widespread transmission is continuing in 3 countries in West Africa: Guinea, Liberia, and Sierra Leone. The World Health Organization has officially declared that Nigeria and Senegal are now free of Ebola virus transmission. As of October 25th, there have been over 10,000 cases of Ebola and over 4,900 deaths recorded. Evidence strongly implicates bats as the reservoir of the Ebola viruses. Epidemics of Ebola occur sporadically among non-human primates and duikers, which are small antelope-like animals, through contact with infected bats. In Africa, human infections have been associated with hunting, butchering, or processing meat from infected animals. Ebola is not spread through the air, water, or through food. The virus is spread through direct contact, that is, through broken skin or mucous membranes, with a sick person's blood or bodily fluids, including urine, saliva, feces, vomit, and semen. Objects such as needles that have been contaminated with infected body fluids, and also infected animals. How contagious is Ebola? While the disease can be deadly, it does not spread easily. Ebola is spread through direct contact with a sick person's body fluids. On average, one person with Ebola is not likely to infect more than 2 additional people. In contrast, compare that to measles, a disease spread by the air where one person easily can infect 18 additional people. The incubation period for Ebola is 2 to 21 days with an average of 8 to 10 days. When infection occurs, symptoms usually begin abruptly with fever, headache, chills, fatigue, and muscle pain. Vomiting, diarrhea, and abdominal pain may follow in 3 to 5 days. Less than half of the cases will experience any bleeding. There could be mild bleeding, including a bloody nose, bleeding under the skin, or bruising. There could be severe bleeding, including hemorrhage and shock. Other symptoms that could occur include rash, red eyes, sore throat, or cough. Some important points to remember include: Ebola is not transmittable prior to the onset of symptoms. All body fluids can carry the virus. The quantity of the virus in the blood and body fluids is very low at the onset of illness and continues to increase during the course of the illness until a patient's death, which is usually 9 to 10 days after the onset of the disease. And if the patient lives to 14 days, the chances for survival are increased. People who recover from Ebola develop antibodies to Ebola, and the virus is no longer present in the body. No specific treatments are currently available, although vaccines and other medications are in development. Early supportive care is critical, including providing intravenous fluids and nutritional support. Experimental drugs have been used when available and approved by the family and the care team. Convalescent serum from Ebola survivors also has been used to jumpstart a person's immunity. Tests have been developed and approved by the FDA for use on an emergency basis for Ebola. Testing is available in 15 states, including Nebraska. All testing done at the state level is confirmed at laboratories at the Centers for Disease Control and Prevention. Getting the outbreak under control in Africa is essential to stopping spread of the virus to other countries. A number of initiatives have been put into place to build up the healthcare infrastructure in Africa and assure that enough supplies, space, and resources are available. In addition, airport exit screening of passengers for Ebola prior to leaving the affected countries is ongoing. Containing Ebola virus disease in the United States is dependent upon 3 things: early identification and screening for persons who may be infected, immediate isolation of those who are suspected of having the disease, contact tracing and monitoring of those persons who may have been exposed to a person highly suspected or confirmed to have Ebola. Early identification and screening means screening for illness and a history of travel to affected countries and/or care of a person with Ebola. Screening should take place at every point of entry into the healthcare system, including 911 calls, ambulance transport, and inpatient and outpatient care settings or other situations. Enhanced entry screening has been implemented in the U.S. Travelers from Guinea, Liberia, and Sierra Leone are now being redirected to the 5 U.S. airports that currently have airport entry screening in place. Enhanced U.S. entry screening includes providing health information, exposure risk determination, temperature, and symptom screening. If a traveler shows fever or symptoms consistent with Ebola, further evaluation of the traveler will occur to determine whether they can continue to travel, are taken to a hospital for evaluation, or are referred to a local health department for further monitoring. The rapid isolation of a person suspected of being ill with Ebola is essential to prevent further transmission of the illness. Protection of the persons taking care of potentially infected individuals with the use of appropriate personal protective equipment is necessary to prevent transmission once a person with Ebola is hospitalized. Contact tracing is finding everyone who has come into direct contact with a sick Ebola patient. Those contacts are then watched for temperature or other signs of illness for 21 days after the last time they came in contact with the patient. Should a contact develop fever or symptoms, they are immediately isolated, tested, and provided care. Then the cycle starts again, and all of the new patient's contacts are found and watched for 21 days. Missed contacts can be a source of more infections if not identified and isolated. If someone became ill with Ebola, what would public health do? Assure that the individual is immediately isolated. Consult with state and federal partners and assess the exposure of the individual to determine their level of risk. Through interviews with the patient, family, friends, and the healthcare facility, identify all contacts and monitor them daily for onset of temperature and symptoms. Some or all of the contacts may be required to avoid commercial transportation, such as air, bus, taxi, and others. If contacts are not compliant with a supervised daily temperature monitoring, legal quarantine of the contact, that means restricting them to their home for 21 days, may be necessary. Please remember these important facts about Ebola. You can't get Ebola through the air, you can't get Ebola through water, and you can't get Ebola through food. It takes the whole public health system, public health departments, healthcare facilities, law enforcement, EMS, 911, laboratories, transit officials, and more to assure that transmission of Ebola virus is contained. In the words of Michael Gerson from the Washington Post, "We don't often think of it, but our way of life depends on extremely effective and respected public health systems. That is the useful, universal lesson of the Ebola outbreak of 2014.